Hi, I'm Courtney. I am a licensed clinical addiction counselor with Cummins. I do the adolescent substance use group. So, we're going to talk a little bit about risk factors that increase risk of using substances or developing a substance use disorder. These are different characteristics or conditions that increase risk. There are three main categories that these would fall into. So, there's social, developmental, and genetic. Obviously, we can't change our genetics. We're born with what we're born with, but there is a benefit to being educated about the risks that our personal genetics may pose. If I know that my parents have a predisposition to substance use disorder, I know that I might have an increased risk as well. And if I'm aware of that, I might be less likely to take the risk of trying substances. So just being aware of those things. Developmental is the younger we are when we're exposed to substances, the higher a risk of developing a substance use disorder. That can be it's normalized in our family and our community, or it could be we're trying different substances at an early age, and that increases our risk to build a tolerance and get used to engaging in those types of behaviors. So if we want to reduce risk, we want to make sure that our youth aren't as exposed. The other piece under developmental would be being able to regulate our emotions, right? So the less skilled we are at regulating how we're feeling, the higher the risk of developing a substance use disorder. Because, we reach for substances because we don't want to feel what we're feeling and we don't know how else to handle it. So if we see someone that's having a hard time regulating their emotion, or we're someone that does, just being willing to provide support or even reach out to a professional like a counselor, a teacher you trust at school, someone like that is trusted and can help provide support and maybe even some tools on how to do that on your own. Lastly, the social impact obviously can come from our peers if we're in school or at work, and it can come from our family or our community as a whole. To reduce risk, we obviously want to try to remove any negative influences from our peer group that we regularly interact with. That can be, if they're actively engaging in substance use, we want to build boundaries with them, or even just other risky behaviors. And then also being able to recognize what is it within myself that triggers me to want to either try a substance or engage in substance use regularly. So, what are some of these things that increase my stress or dysregulate my emotions? And then what of those things am I able to take away from my day-to-day life? And then once we get rid of some of these triggers or these negative influences, it's important to build up some protective factors, which are things that reduce risk because they're positive. And we have another video coming that can outline some tips on how to build those up.